All right, we will begin in about 1 minute. All right, we will get going. So good evening, everyone, and thank you for joining us tonight for our second virtual session on diversity in health tech. My name is Paige Simel. I am a talent acquisition specialist here at Memorial Sloan Kettering. For those of you who are tuning in tonight for the first time, MSK is one of the world's oldest and largest private cancer centers. For over 135 years, we have been devoted to exceptional patient care, innovative research, and outstanding educational programs. In October of 2019, Klaus Jensen joined our team as our first Chief Digital Officer and the Head of Technology. Together, we began our journey on the digital transformation in support of MSK's mission and strategy. Tonight, we are excited to be hosting our second virtual session that is focused on product and design. You'll be hearing from some of our passionate team members who are part of our Digital Informatics and Technology Solutions team at MSK, otherwise known as Digits. We will kick off tonight with brief openings from our panelists, and we will end with a question and answer session via the chat feature in Zoom. We thank you for joining us this evening, and please be sure to visit our career page with all of our current opportunities available, specifically in product and design, as well as the rest of our Digits organization. So to kick us off this evening, I'm going to ask John to introduce himself and share a little bit of his story with us.
Great, thanks, Paige. So I'm John Phillip. I might be the old timer on this panel. I've been at MSK, I'm not going to tell you how long, but many years. It was my first job out of college. And I'm in my 40s, so let's just put that as a reference point. So I came out of college and I was a chemistry major and a poli-sci major and pre-med, so I was like all over the map. And Sloan was a place where I had some colleagues or friends that were looking at that place, so I applied and ended up getting into a research lab. And one of the things that sort of amazes me as I look through my journey is just sort of the roundabout way where I got where I am, and the opportunities that I think Sloan offered and afforded that in terms of making that journey possible. So as a researcher, I was in the lab for many years, and but also because of the tuition reimbursement program, started to do a public health degree in epidemiology. Again, not at all related to my chem work, and started to study data science and statistics and analysis there. And as I was working in the lab, I actually got opportunities to write some code, which I hadn't mentioned. I also before I became a chem, poli-sci, and pre-med person, I was with my public health skills in epidemiology and biostats. I started analyzing the lab's data. And then over time, eventually, they just asked me to take over that whole computational effort for the lab. And that's how I ended up becoming one of the early bioinformatics engineers at Sloan Kettering. And in that role, I ended up growing to the point where I was leading the lab's informatics efforts, and then eventually got recruited by another department at MSK to come over to the operational side in what was called health informatics at the time, and became a project manager to help help bring in a lot of the genomics data that's coming out of the research side into the clinic. And then in the last year, ended up being asked to help with product management in terms of the larger efforts that we have here at MSK, specifically MSK Direct, which is bringing remote services, patient services to the remote patient at MSK. So it's been a really roundabout journey. I will say that being here at MSK, I met in the research world and the operational world a large number of very interesting people from all over the world. The researchers are recruited from every country probably under the sun. Entire labs are transplanted from like various parts of South America or Germany, and they end up here in New York. So it's pretty interesting. In the research world, you walk through the lab and you hear many languages being spoken. And on the patient side, certainly as well. And it's a pretty interesting and diverse place. And it gave me the opportunity to stay intellectually interested while working at Sloan Kettering over 25 plus years. And that was sort of important for me, right? Not being bored at work. So that's sort of how I got to here. I'll hand it off to whoever's next. Thanks.
Thank you, John. I appreciate your journey throughout MSK. Up next, Christina.
Hi, everyone. Can you hear me? Great. My name is Christina Ward. I'm a director in health informatics, and I am also the product manager for our digital enabled care. My journey, and I'm not ashamed to tell you, started about 25 years ago at MSK. So John is not the only old timer on the panel. And that journey, I can honestly say, when I'm looking back now, I have experienced 2 digital transformations at MSK, at least in my mind. My first digital transformation happened in 1998 when we went from a paper chart to an electronic health record. And that was revolutionary because it enhanced the way that we worked, it accelerated the way that we worked, it made things easier. And I did not have to hunt all over the hospital for paper charts. I don't know how many of you have ever hunted in a hospital for a paper chart, but it is like finding a needle in a haystack. You don't want to do it. And so it was like light years ahead of where I even thought we would be. And it was so remarkable that I was able to help build that first system, lab, radiology, pathology, and now to see where it has come to here in 2021. It's really been an incredible journey. So fast forward to where we are today, and we are now in a space where we're not only buying vendor products, but we've really taken a look and said, we have some extremely skilled people here that can design and build products. And why don't we look at what we need and build the things that we need? And so I think it was JP Morgan that said, you go as far as you can see. And when you get there, you go further. And I think that that's been really summed up my journey. I went as far as I could see, and we all went as far as we could see, and now we're going further. So it's a great time to be a part of MSK.
Thanks, Christina. Louis, if you'd like to take the stage.
Sure. So I think I'm the other side of the scale here. I've been with MSK for about 24 weeks. So I joined this past fall, so fairly new to MSK. I came from a consulting background. I am the product manager within our tech incubation group. And essentially, it's our job to look for any kind of upcoming opportunities and challenges at the intersection of both cancer care and technology, and start to address them and think about them before the rest of the organization even gets there. One example of this is this past fall, we worked on an app that sits in on telemedicine appointments. Obviously, 2020 was a very big year for telemedicine. So while the providers and the rest of the organization was focused on get everyone set and onto telemedicine, we were thinking of what's telemedicine kind of 2.0. So we build an app that listens in on telemedicine, not only transcribes the conversation, but is also able to detect when either the patient or the physician discusses any appointments or prescriptions, so that could remind the physician after the call. And we were even able to build in some light sentiment analysis. So we'd be able to detect, for example, if there was a lot of negativity in a patient's voice, and maybe recommend to the physician that the patient see a social worker or something like that. And so not only is it an incredibly interesting area to be in, 2020 was a lot of things, but very, very exciting for healthcare in more ways than one. And I think it's interesting because being a product manager within this group, it's kind of a dual-sided role. So not only am I a traditional product manager in the way that I'm working with designers and engineers to build the experiments and the proof of concepts that we kind of produce on a periodic basis. But I'm also thinking about the product of innovation being, how do we get all this knowledge down to the rest of our groups? And how do we take the things that we build and make them a reality? So that's a little bit about me.
Perfect. Thank you. Fernanda?
Hi, so I'm Fernanda Polubriaginof. I'm the Director for Consumer Health Informatics here at MSK. I joined about 1.5 years ago, so certainly not as long as Christina and John have been around, but it has been a really exciting journey. So I'm a physician by training. I got my medical degree in Brazil. I'm from São Paulo. And then I started to do a lot of research. Back then, Christina, to your point, I did use paper charts and I practiced with them. So I know the pain points of using paper charts, but I also did research based on that. So I used to sit at the office and literally open chart by chart and gather the data and put in a database for us to be able to do research. I started to focus on cancer research and ended up moving to the US and focused on patient-facing technology. So basically, how could we use digital technology to engage with our patients in the cancer space? How could we assess the risk for disease? And I ended up falling in love with it. So I decided to go back to school, and I got my PhD in biomedical informatics here in New York. And a few years later, I joined, once I finished my PhD, I joined another healthcare institution in the US here in New York, but ended up moving to MSK. And the really amazing part of MSK is that we can do the development, ideation for the patient-facing technologies. We can understand where we add a lot of value. We do the development, we do the implementation, and then we learn from it, and we can incorporate that into our patient-facing tools. So in my role here, I oversee the health consumer platform, which includes all the work that is patient-facing, so telemedicine, patient-reported outcomes, our patient portal, remote patient monitoring. Of course, with COVID, we ended up expanding a lot of our portfolio because it was so needed for us to reach our patients from home. But the amazing part about my MSK is that we can touch all of these patients digitally. And to me, as a clinician, that's so meaningful, right? We can have such a huge impact. So it's really a really exciting organization. And he gave me the opportunity to continue to touch patients' lives through digital technology.
Thanks, Fernanda. Jackie?
Surprised nobody's forgot that they were on mute yet. Giving everyone a fair warning. Hello, my name's Jackie Denmark. I'm a lead product designer on the clinical and logistics team. I started a little over 1 year ago, late 2019. My most recent project we just kicked off. We're working currently to streamline our patient transfer process and all the pain points that are involved with trying to pull together the right type of documentation and make sure it's as efficient and user-friendly as possible. My background is largely in the agency and consultancy world, small and large UX design shops. At some point, I decided I want to be a chef and eat my own food too. In order to do that, you kind of have to be an in-house designer. So here I am. I've helped lead product design teams across several verticals, mostly financial technology, a little bit of airline and auto, CPG, pharma, and consumer health. What brought me to MSK and what attracted me to this particular opening, similar to everybody else, our mission. I think that nearly half of us will suffer from cancer in our own lifetimes, which means nearly all of us will suffer or at least witness somebody else suffering from cancer in their lifetimes. So I'm here, similar to my colleagues, to make a measurable, tangible difference in all the lives that cancer touches.
Thanks, Jackie. Very well said. Dom.
Hey, I'm Dom. I'm the lead product designer for the health consumer platform. So things that patient touches, as part of the journey with MSK, kind of go through one of the products that I help manage with the digital transformation that everyone's working on. We are trying to reimagine and upgrade that experience to prepare MSK patients in a better and updated and friendlier way. Continue to always improve on it. And get it ready for all the exciting new things that we're offering. So I'm pretty new to MSK, and unlike many of my colleagues, I definitely did not have a heavy healthcare background, just very little bit of it. And I was kind of listening to John and kind of laughing because his goal of not being bored at work is pretty much what brought me here. In addition to to our mission, I think as Jackie said, definitely cancer touches all of us, and it's a great bond. It is a great bond to know that a lot of your colleagues and a lot of the other designers here have like the same drive, and feeling purposeful and feeling like you are doing some good. So, and it's an interesting journey. As a designer, my first degree was illustration. So it's can't be farther away from healthcare. But along the way, I found out that hey, I have a flair for designing with data. That was back in the 90s. I'm pretty old. So and then along the way, you learn that I can actually envision products with relatively little information. So I started, kind of getting the niche into emerging tech, with like when RFID was a thing, I was designing to that. When all the iOS and iPad launched, I was in there, designing apps and experiences before the iPad came out. And then, got my way into like conversational UI, working with Watson Health for a little bit with the oncology, imaging, and genomics. And then, and just really found a love in healthcare, even though it is, arguably a lot more stressful than like fintech or distribution verticals, because you really can't make an error, because it has real impact if you do make a mistake. But just really amazing to be here. When I heard about this opportunity, I basically just said, I don't care what you have me do, I'll mop your floor. I just want to be in the organization and be part of this effort, because I just really believe in what they're doing, and I'm just excited to be here.
Thanks, Dom, and that is completely 100% truthful as he said it to me. So I appreciate it, Dom. We're happy to have you. Avi, you're up next.
Thanks, Paige. Guys, I'm Avi Kwatra. I have been MSK for almost a year. I have been working for MSK before this, so clearly I like it, which is why I keep coming back. Why I keep coming back, a very short story, I'd like to share that, right? Cancer is a very scary word, but it's just a word until you yourself or somebody close to you has it or gets it. And once somebody a computer science background, I've a master's in technology management. I worked through many different industries, and like I was working for retail, a lot in healthcare, various hospitals and OTT streaming platforms. And at one point, I realized that I wanted to go and really focus on product and also strategy of what makes more sense to our users. I went to business school, focused a lot on product development, worked in a lot of different companies, and decided to come back to MSK. My experience previously has been pretty much in bringing products to the market, and which could be for different audiences. They were health systems and also some retail CPG. So if you are looking to make a difference, if you're trying for that meaningful impact in your profession, MSK Digital is a great place to just be here at this point, because it's really a place to be right now if you're looking to make that difference.
Thanks, Avi. Really appreciate that. Lernik.
Let's unmute myself. Hi, everyone. My name is Lernik. Thanks for joining online and also for folks who will be watching the recording offline. It's such an honor for us to share our experiences and journey, how we ended up with MSK. Yeah, I am actually sharing a lot of diversity points with the rest of the panel folks in terms of being a physician by training. I have done general surgery residency, have been practicing for many years, and I'm a woman, which was at the time when I switched to technology was not such a popular transition, I want to say. And also I will share that I'm from overseas. So that's another diversity point that I share with some of the folks on the panel. Another point that I want to share in terms of my diverse background is I'm first generation pursuing higher education beyond high school, which is has been a big drive for me in terms of making impact. In terms of how I ended up with MSK, I think it has been such a clear and easy decision because the combination of the diversities that I have has been celebrated and welcomed with Digit's team and with this position. I'm a product owner with MSK Direct program, which is basically a program that aims to expand MSK expert access to remote patients who otherwise don't have the means to access MSK quality care care remotely. So with this transition, one small story that I want to share is when I was taking care of one of my patients many years ago, I was on a night shift. And usually I would do a rounding around the nighttime to my patients. And one time, one of the patients asked me that if there is an easier way for me to communicate with my physician in terms of my plan, because he was saying, you guys are coming only once in a day, and then we don't see you until next day. Is there any way that we can communicate with you more often? And it just triggered a conversation around having a technology that they can send out their questions while they're waiting without like having the nurse interrupting their workflow, etc. And that was my first sort of step around thinking as a physician that is thinking solution, using technology as a solution. When I switched later on into getting engaged with technology, it was very clear to me that solutioning through technology, as we have all noticed after COVID, it became, of course, much more clear that it's very much needed. With MSK Direct, we're trying to, as I mentioned, expanding the expertise of MSK physicians. It's a major impactful initiative and major initiative across the, I want to say it would have impact across the globe. Some may argue that. So it's such an honor to be part of this work. So yeah, that's a little background journey and also my participation with Digit's team. Thank you.
Thank you, Lernik. I'd like to call on Wynne next.
Okay, hi, Wynne Leung Kim. I'm a product manager for the MyMSK patient digital experience. So I joined about 9 months ago because there's a digital transformation that was going on at MSK. They had some really interesting people that had come over to the organization, and they started to focus a lot on technology. And so, you know, at this point, I had a pretty long journey in digital technology, mostly working in large enterprise companies. as my career progressed, I worked on more and more data. So a good part of my career has been building data platforms, from advertising, behavioral targeting, to search and cataloging structured data, to television viewer measurement, credit card purchase behavior, location data. And then so I didn't know how to pivot over to healthcare, but I thought it was a really interesting frontier from a digital and data standpoint that we're trying to get to. That's where all the funding's happening. So it was fascinating to see the transformation at MSK because of the focus and the organizational changes that they were driving, top down and bottom up. Like, I mean, the entire organization's like very new, and the way that they structured is also very interesting. So we were in the middle of a pandemic. I had some time to reflect and realize that I just wasn't fulfilling a purpose in my life, and so I intended to double down and think things that matter, and really just wanted to make a positive impact. So part of this was also just timing. So this came up, someone called me up and said, hey, would you be interested in this position? And I was like, what position? And so as I learned more about it, it was like, wow, I'll mop floors, I'll do anything, kind of like how Dominic was explaining. And so I joined, took a pay cut, met a bunch of new people, got into an industry where people just brought their passions every day to the job, and it was just fascinating to have so many different backgrounds. Like, we have physicians, we have people with MPAs, people with regulatory backgrounds, and technology backgrounds, and so this kind of diversity was just very cool. So I had worked in technology for a really long time, and so you had a lot of technology people, but not specific specialties in any other area other than the technologies. You would work with a PhD person that worked on natural language, but it's still technology, right? So here it's a little bit different. So it's been exciting, it's been invigorating, and I feel great to be part of a community that wants to use data to transform a patient experience and really accelerate the quality of care. So it's very meaningful work. I also serve on the board for a couple of nonprofits in the Lower East Side of Manhattan, Hamilton Madison House, Two Bridges. They care very much about public health and bringing a lot of the services to the local communities. I'm also an avid tennis player. I run a 3-ring circus with my family and kids. I have a couple of guinea pigs. I'm hatching a couple dozen ladybugs. So I've got a lot of different passions. And so it's been a pleasure to be here. So thanks for having us.
Thanks a lot, Wynne. Liz.
Thank you, Paige, and thank you all for joining this evening. I, like many others on the call, have been personally affected and touched by cancer in my life. I lost my father to cancer over the course of just 3 months when I was 16 years old. My mom is a breast cancer survivor, and my aunt is a cancer survivor. As a result of all of this, I myself have gone through a lot of genetic testings and panels, and luckily I'm okay. That's always made cancer really be sitting at the forefront of my mind from a very young age. And over the course of my career, as some of you may also be confronting some of these feelings right now, you reach a point where you really start thinking about your legacy and what is the impact and the value of the work that I'm doing, and is it something that that leaves the proper legacy for me. So when I got the call from MSK back in the fall of 2019, I was immediately intrigued and felt really passionate about joining the team, which I joined in April of 2020. So coming up soon on my 1-year anniversary. And I was particularly motivated by the nature of the transformation and this focus around a new mindset that included a much more human-centered approach, being more insights-driven, moving more quickly and with more agility, and driving more connections, both internally and externally. So as MSK aspires to be this cancer hub amongst the healthcare ecosystem, we really have an unprecedented chance and a window of opportunity right now to really make impact in the world, really. And I feel like everyone you'll hear from this evening is saying a genuine purpose, you know, a career opportunity, right, amazing group of people. I think you know, this moment is just to be here on the call and hoping to answer your questions later this evening. Thank you.
Thanks, Liz. I think you were breaking up a little bit at the end there, but that's okay. I think we heard most of it. Everett, you're up next.
Hi, everyone. My name is Everett Weiss. It's an absolute pleasure to be here this evening with all of you. And you know, my background is I've actually been in healthcare my entire professional career. So what was new for me was making the transition into information technology and informatics, the latter of which was a field that I didn't even know existed. So I started off actually as a general pediatrician. I practiced for 5 years, and I actually practiced in an environment where the practice I was at, they didn't have any electronic health records. And I was very intrigued because the hospital that we were affiliated with was just starting with the electronic health record, and they were looking for people who were going to volunteer with clinical backgrounds. And of course, I was very intrigued and jumped at that opportunity. That's where my journey really began. I got the itch to do more and more. And ultimately, I started talking to colleagues and peers and tried to do some pretty intense networking to see what this field was all about and was there a space for clinicians like myself. I got a lot of great advice, although at the time, there was no direct path for a clinician to go into informatics. And so I jumped at various opportunities, the first of which was I had the opportunity to join Allscripts, which is an electronic health record vendor organization, and actually one that we currently use here at MSK. I had the distinct opportunity to really learn about how vendors think about products and develop in the software development lifecycle, how they relate to customers and clients. And it was at a very interesting time actually in healthcare, because it was right at the precipice where the government was really trying to push technology and push hospitals to adopt technology. And so there was a lot of money on the table, and the vendors had a lot of pressure to really get this right. And so it was interesting to see the switch from a lot of research and development to really meeting regulatory requirements. So that was, I learned a lot when I was there, and that really prepared me for my next chapter. I got invited to join Roswell Park Comprehensive Cancer Center as their Chief Medical Information Officer, and I did that for 5 years, really taking the opportunity to help them to really transform, you know, the clinical systems that they had. And so we did a lot of great work, and the opportunity to come to MSK came along. And it, like many people here, you're obviously very connected to the mission. You know, what better mission than to be there to help support patients at one of the most difficult times in their lives and in their families' lives. But the other thing that was really attractive to me about this position at MSK was merely the huge amount of talent that I was going to be working with, and the amount of things that we were going to be able to do. One of the things that I really truly believe in is the power of digital technology to really transform the paradigms of how we think about healthcare. It's clearly changed over the years, but we have a real opportunity to do things differently, and technology is really at the center of that. So I took the position of Associate Chief Health Informatics Officer here at MSK just over 6 months ago. So I'm among the new crew here. And my other title is that I am the platform owner for the clinical and logistics platform. So my team and I, we are responsible and accountable for all of the clinical applications that our clinical staff, end users, touch and interact with on a daily basis. And I think that one of the proudest things is I just work with an amazing team. All of the panelists here, we intersect, which I think has already been brought up. The fact that we get to work with such a diverse group of people with so much talent, so much expertise across diverse areas is one of the things that really makes this this job not a job. It's we work very hard, but it's a lot of fun. So I'm so thrilled to be here and also to be sharing my experience with you. Thank you.
Thank you, Everett. And thank you to all of our panelists that we have introduced tonight. We're going to start opening the Q&A for the last 45 minutes here to get everyone answered whatever they may have. One of the first questions that came through, we will direct toward Everett and Fernanda. So someone has asked, they're very interested in transitioning from direct patient care, where they touch a handful of patients per day, to product design where they could make a larger difference. Would you suggest particular training and/or education programs to form some sort of job within MSK to transition over to the product side?
I think Fernanda's looking at me. So, first I'll tell you kind of an anecdotal story really quickly. I went through all of this training to be a physician, and that many years of undergrad, medical school, residency, and then there you are. And I remember one day looking at my wife saying, I think I want to do this other thing. And so she told me that, I got to have one very early midlife, career crisis where I got to change. Because the one thing I didn't, say during my introduction was, in addition to going to join Allscripts, I actually went back to school as well. And I pursued a graduate degree and got my certificate in biomedical informatics. And then I additionally also pursued a board certification in clinical informatics. So there definitely was a part of this that I pursued an academic track to give myself the background and the knowledge and expertise to jump into an informatics role. There are now fellowships too that are very robust and very strong that allow clinicians to move into an informatics role, and also allow you to have that experience, firsthand experience, and also the credentials to go with that. So I think that there's so many different things that you can do in information technology and informatics. And in fact, coming even to MSK, in my current role, I think many of us are now learning about, product management and product development, which was very new for me. So it's been a very steep learning curve. I think that one of the most important things is making sure that you network like crazy, get to meet lots of people, talk to people, and figure out what things you're really passionate about, because there's so many different areas. If you just look at the broad spectrum of the people on this panel, there's a lot of different areas to be able to insert yourself into. So first step is really just understanding the diverse array of opportunities, and then I think it's really through that network, figuring out where you want to follow. So I think certainly some education, some academic studies, networking, and potentially some training along this on the side.
The one thing I would add to Everett, I too mentioned I went back to school and got my PhD in clinical informatics. And I think that now with digital technology, there are many programs, and if you reach out to me, I'm happy to share a few around product in healthcare and the development of product and product management. So I think it really depends on which area you're trying to focus on. But I agree with all the other points that Everett made. There's a lot around a combination of education and networking. So I think it really depends, but there are a lot of opportunities and a lot of routes that a clinician could take to move into the digital space.
Wonderful. And I see a couple of questions or a couple of people chatting about Jim. Jim, would you like to introduce yourself? Jim is in talent acquisition, and I'll let him answer some of your questions.
I feel so complimented. Yes, really quickly, because I really want to have this time spent with the panel. My name is Jim Renane. I work alongside Paige with Digits Recruitment, and I'm just really happy to be here. So I'll be answering your questions as well going forward, but I really want this to focus generally with this panel. But it's a pleasure meeting everyone.
Thanks, Jim. Okay, so we'll continue moving on with some of the other questions we've got. So what is your advice to a budding product manager with a healthcare background, limited product experience? On the experience level, they've worked with physicians, clients, patients, and cross-platforms within various departments, and very similar to Dom, are ready to mop the floors to get in here. How can we help them, or are there some sort of programs that we recommend to get into Digit? I'll leave that open for anyone that wants to take a stab.
I can take that, Paige. Being from like a product management background, and when you start thinking about building a product, it's very interesting, right? Because traditionally, when we build platforms or applications, it's project management, and it's a mindset change, right? How you think from a very predictable model of building an application going into a product phase where you are looking at the impact and the context of what situation and what capabilities you're building for your end user. So for anybody who wants to be able to get into Digits or at MSK, I think the key things to aspire to learn and to get there is to make sure that you understand the patient's or the end user's perspective. That's the key thing, right? You need to understand what you're solving for. And that's the foundations for any product, building up a product. What are you solving for? And within a product, there are two things. Are you building something which is must needed to make it function, or it's everything bells and whistles, right? So once you learn these three foundational elements, I think it's really easy to transition into that product role.
Yeah, if I can add to that, it's like any other career advice that I've been given. So I actually did not come in with a healthcare background. So you have an advantage because you can speak healthcare, and that's great. But the career advice that I've always gotten about how do I get into this role is try to do the job first and find every opportunity where you can actually do that job, and do it well, so that you have a really good story to tell. And so part of this is just flexing that muscle, and having a good story that you can base your interviews on, and you have a good resume and a good stack of facts that follow you, that support your story. And part of that gets you in the door. But then it's also about, when you're actually in the role, are you able to hold to that level of standard that, that a good product owner or product manager would be able to do their job.
Thanks, Winnie. I will direct this one over to you, John. Can you please discuss the impact of diversity playing a role in technology decision-making?
Sorry, I got caught by the mute button. Thanks, Jackie. Could you just impact of diversity on technology? What?
How does diversity play a factor in technology decision making?
So that's a great question. We actually, designers especially are faced with this question from a product management perspective. We're thinking about, are the products that we're building, how are they reflecting the diversity of our population? And so that's a pretty big consideration for us in terms of making sure that, part of my background from a data science perspective is where, some of the work that I do with my other teams is about machine learning. And, you read in the literature, especially some of the fewer recently from Google, about how data science is, biased and therefore not treat certain populations and has poor response and performance in certain populations that it does in others. So I think, when we're thinking about here at MSK about rolling out products, it's a big consideration that we have to think about how different groups respond differently to the products that we're rolling out. Are the populations diverse from a racial perspective, from an age perspective, from a gender perspective, from a technology understanding perspective, like who's, in conversations that I've had, say with Jackie, who's helped us on a couple of products, like, we have to consider what percentage of our user base is good with technology and what percentage are not, and how do we consider the whole gamut of people, and who are we missing along the way, and how we bring them back into it. So diversity is absolutely a big part of how we do our jobs and how we think about what the solutions are. And it's obviously a lot of work. And just being transparent, we're not always going to get it right on version 1.0, which is why in our agile workflow, we really think about iterating and keeping design and that research experience in play to constantly update and say, are we catching everybody, and having metrics as well along the way to measure how well we're doing.
To just kind of jump on
sure, go ahead,
that answer a little bit, and to think about it from a different lens, everything that John was saying is absolutely true, and I agree with. But I also think, as someone from a diverse background, it makes you kind of acutely aware of the different spheres people live in, and you have your cultural background that you wear, and you're able to jump between that and a more American or more or a different type of background. And I think those sort of skills, especially for a product manager, being able to shift from talking to a designer to an engineer to talking to a provider, it makes you get kind of everyday practice, even though it doesn't seem like it. It's the same set of skills.
Yeah, I would also add, in the product space and in the product design space, I think one of the core differences between going into a lifelong career in healthcare as a clinician versus as a technologist is that as a technologist, you're always forever a beginner. Going into the clinical field, you're growing your expertise. And so while we are doing the same with the hard skills and some of the soft skills, who we design for changes every single day, and we are not our users. And because of that, we're constantly listening. We always have to take a back seat to exactly who is using the thing that we're helping to drive change under. And it can't always be a digital solution because not everybody has access to digital solutions. So whatever we're addressing needs to address the big picture user journey. And we need to make sure that there's diversity of thought, diversity of background, diversity of insight. Otherwise, you're only ever as good as the work that you put into it.
I think in the health consumer platform, we definitely experience that, technology is a powerful enabler for some, but definitely a blocker for others. So I think, this team among all teams have the strongest awareness of that barrier. And, I think we try to, little by little help, expand that to as many, public members as possible. It is definitely a very important considerations for our day-to-day lives.
Thanks, Tom. I'll send this one over to Liz. What is the fun part about your day being in product and or design?
There's so many fun parts. Part of the fun part is the diversity of being able to work across so many platforms. So I neglected to mention that I lead the design team. And as a part of that, I get exposure to the health consumer platform, clinical logistics platform, service platform. We're building out right now the first design system within MSK. So there's so many different things to work on, so many different challenges, and like more and more opportunities to do workshops. Now that we're getting into the silver lining on the other side of COVID, looking at what does it look like to spend more time getting our teams into the hospital to shadow some of our physicians and really getting closer to how we deliver unique patient value by starting to utilize some digital tools and thinking about redesigning the world in a hybrid environment. So as we continue to explore things like telemedicine and remote monitoring and treatment at home, it is like a tremendous opportunity for designers to really reimagine how healthcare functions at every level. So it's, I think, a really unique opportunity to be here and to really be able to fundamentally use and stretch your imagination on a daily basis, which, you know, as Everett pointed out, of course, it's still work, but I think we do all genuinely bring a lot of joy to what we do every day. And it is, as hard as it is sometimes, it's truly a lot of fun and great people to be on the journey with.
Thank you, Liz. Christina, I'm going to come over to you for this question. There's so much happening in health tech right now. How do you stay current in this industry? Are there newsletters or academic papers you read regularly and or are subscribed to?
I actually am an avid reader. I think I read everything I can get my hands on. The Harvard Business Review, I look there in their technology section every morning about what's going on, not only in terms of technology, but in terms of product in general. And recently, of course, as we've been in this space of diversity, there've been lots of articles around how do we handle all of these themes that we're faced with in our environment. So I would definitely say anything that you can get your hands on, whether it be from general New York Times to business reviews, success journals, medical journals, read avidly, because I think that's really how I stay ahead of what's going on in our environment. And I like to also share that with people that I work with. And we do that a lot. We share a lot of articles with each other and really learn from each other. And then also keeping up to date with any certifications that are out there, any sort of courses or learning that you can take. I think that's really also really important to stay ahead and to stay current.
In the same token, what are some of the emerging technologies that we are focused on as we continue to learn and grow within our organization?
Oh, so many things. I know Everett is probably, his mind is just wielding right now. As we really think about looking at how we can use artificial intelligence, and Fernanda, you know, how do we monitor our patients with devices and make sure that we're connected to them even when they're outside of our brick and mortar. There's just so many pieces of technology that are happening now and emerging that we can actually ingest and begin to use and even develop among our teams to really enhance the way that we care for our patients and also enhance the way that our clinicians work. So lots of new technology emerging all the time. And I think that as long as we stay at the forefront of understanding what the need is here at MSK and what our patients' needs are, I think one of the things that really drives me from day to day is fully understanding that we have the ability to build things that will help. For many of us that's worked with vendor products for a very long time, what happens is you get to a point where you've really supported a workflow with technology, and then you get to that one space where you have to do a workaround, and then it loses its value in some way because of that workaround. And I think that If we are designing for what we really truly need for our patients and for our clinicians, we can really make the things work from soup to nuts. And I think that that's where we're going with technology.
I'm gonna just add one quick note on that, that I think the direction that MSK is going, at least on Digit's level that we are aware of, is bringing MSK to the patient. And basically, especially since COVID, it's how we can enhance that reach out to patients specifically that don't have the means to access MSK's expertise.
And I'll just add one more thing to both Lernik and Christina. And this is actually a prelude to a lot of John's work. But you know, healthcare is big data, and there is so much that we can leverage the information that's out there to make better, more informed decisions, not just for our clinicians and helping them to offer better treatments to our patients, but also to really enable our patients to be engaged in their care, to better understand, you know, the science behind all of the medicines and the treatments and the procedures that are being recommended for them. But how do we leverage big data? And one of the things that you'll hear a lot about is machine learning, and how do we take very large voluminous data sets to help to look at large populations and make better decisions, not only on an individual basis, what we often refer to as person-centered care, but also on a population basis. So how do we take care of large populations of people? And what MSK is really focused on right now, to just expand on what Lernik was describing, is we're really trying to expand our footprint. We want to make sure that the expertise of the clinicians at MSK has no boundaries, that you can be anywhere, and our clinicians can offer the same expert care that we would offer to patients who live within a 5-mile radius anywhere in the world. And we have the technology to do it. And the team that you're looking at on this panel are some of the very contributors that are helping to make that happen.
Thank you, Everett. One good question. Are there any specific practices used to empathize with your users, for example, patients, clinicians, et cetera? And do you have direct access to interview them, observe them in their setting, et cetera? A lot of head shaking. Louis, I think I saw you first, if you want to answer that.
Sure, absolutely. And I think this is actually related to some other question I was answering earlier around designing for clinicians, especially. So I'm fairly new to the organization. Access to clinicians has been very, very easy. You know, we're so lucky to have the clinicians, the data, as Everett mentioned, that MSK has, and it puts us in a unique position to leverage a lot of these expertise rather than kind of come at it with, you know, a different lens, I guess. One thing that COVID has made it difficult to do is to kind of work with them in their clinical settings. But that's something that I know that a lot of technologists have done in the past, pre-COVID, and we hope to do kind of directly after. But it really allows us to work with the clinicians and patients and caregivers throughout the product design and development journey. So it's not like you're kind of plopping something in front of them. They're able to provide feedback throughout the journey, which is really, really, really nice.
And the one piece I would add to that is that I really find amazing about MSK is we actually have a patient and family advisory council that is engaged with us. They are part of the committees for the platforms. They give us feedback from the very beginning all the way through deployment. So we certainly have direct access, and they're a big part of how we developed our products.
Yeah, I think as well as, I'm sorry, Jackie, as we expand our aperture a bit, we're also now looking at this new cohort of people that's called the cancer curious. So as we look at the general population and think about population health, we're doing more and more investigation and starting to get into more design research there, which is really exciting and informing some work that we're doing this year.
Yeah, I think the most brilliant user experience design is truly invisible in that if you have a goal in mind, you can reach that goal independent of the thing that's placed in your hand. And for that reason, we're also exploring options for testing some of our products with general health consumers. Because if grandma or your 5-year-old nephew can use it, in theory, anybody can use it. So the access is sort of infinite. On the flip side, when it comes to clinical staff, I think one of the luxuries we have is that it's common practice to have clinicians shadow other clinicians. So it doesn't feel like an obstruction of their day. It feels very natural to them. And addressing our questions organically has been pretty seamless.
Thanks, Jackie. Jackie, I'll ask this to you as well. How do you make sure that your digital designs are accessible for people with different disabilities at MSK?
Yeah, I think that Dom can speak to it from a health consumer platform perspective and some of the things that we're going to ramp up on, I'm sure, in the coming months. I'm not sure if everyone on the call is familiar with the term design system, but it's us leveraging a repeatable set of components that have already passed accessibility guidelines, so that when we do integrate them into a layout or a technical solution, that in theory, they should at least be readable, both from a screen reader perspective, a color contrast perspective. There's a lot of different tools that the design team uses to sort of vet our early concepts for some of those WCAG guidelines and ADA compliance guidelines. But going beyond that, you usually try to partner with some sort of consultancy that can actually go really deep on analyzing from a heuristic perspective what your current product set is doing poorly. So there's a lot of paid for services that you can access that will go a little bit deeper than just the common checks and balances that we go through.
Yeah, we definitely have some, common guideline and, individual considerations, on that front. So, healthcare actually, but that's more Jackie's side. It attracts the most people with color blindness because color is such a loaded thing in the healthcare field. So some of that is, so we're very trained to be very very mindful, for some of those with color limitations. From, what Jackie said, a lot of our reusable components go through, passes the ADA, passes the basic contrast test. Our work is also being audited by, compliance and accessibility audit firms. There are some of the softer side of things, and we just try to be more mindful, such as, people with maybe, some motor control with the hands, and we sometimes talk about how they might control, how the mouse might travel along the screen, how they might be using the mouse or the phone. So we do try to be a little mindful. We're definitely not perfect. Our digital footprint is pretty big. But we are, every day we are backlogging and and discussing new issues and ways to improve on them along the way.
Thanks, Dom. Okay, I'll ask this for Everett. How do you determine whether to build or to buy?
That is an excellent question. So there are so many factors that actually go into that decision. One I would say is just looking at the size of your organization and your team and the resources that you have. So, smaller organizations, certainly may be limited a little bit more by the number of resources to maintain products. And they might be more apt to look to the marketplace to procure products and then use them. There is absolutely a cost to building your own products. While you certainly can customize and personalize it to the nth degree, There is a lot of discipline that must be utilized to really focus on what the needs are for the organization and to have the biggest impact. But there's also the decision when you're building something, that there's a commitment to maintaining it over time and continuing to build and grow. There's other considerations too, which is just when you look at the entire portfolio of all the products that you have, one of the really big foci of all of our work right now is how do we vertically integrate all of our products? They all might do very niche things, and we really want all of our products to be working in synchronicity. You know, unlike what we might do in our personal lives where we bounce from one app to the next to do very specific tasks, you know, our clinical staff and also our patients, we're very sensitive to their workflow, and it's the critical piece that we look at. So when we're evaluating products, we're evaluating, number one, does it really meet the stated objective of why we're even looking at that product? Can it do that? If it can't do something, then the question is can we build it ourselves, and what is the cost to doing that? If we can look at a product on the market and we ask, you know, can it integrate with and interface with the other products that we have? And what might that look like? And what would be the maintenance of doing that? There was always there's this back and forth kind of pendulum swing of, you know, best of breed versus, you know, going with one system that does it all. And there's no one really good answer to that because things change and the software development life cycle is so short, you know, typically about 2 to 3 years, where it's hard to look too far in the future because things change that fast. So we really have to look at the present and understand what problems are we trying to solve today, and also have a vision and a strategy for where we want to be going, and look at whether a product that's on the market, if it will meet the need and it's reasonable in cost, it often makes sense to purchase those products and bring it into your portfolio. But you also want to be making sure that you're not adding to your portfolio indefinitely. And our senior leadership within Digits always has us, you know, thinking about, you know, what kind of consolidation can we do? You know, we bring on new tools, can we sunset other ones? And the same is true when we're building things. We always want to look at, you know, is it still relevant? Can it bring us to the next phase into the future? So there's a lot of visioning, a lot of strategy involved in those decisions. Not an easy question, but there's a lot of factors that play into it. So thank you.
Thanks, Everett. To wrap up, I know we've only got a couple minutes left. What I'm going to do is I will ask one question, and I'll ask all of our panelists to give their best one piece of information to it. So the participant has asked, can everyone share an example of how your life experience manifests in design creation, decisions, and consciousness? So we'll start with Jackie, since you're first on my screen.
Sure. I think for the past year and a half, I've been a caregiver for my mother who's been suffering from breast cancer for some time now. And that experience has helped me listen to technology and product heavy calls with an empathetic ear. I think the fact that, as mentioned earlier, the fact that we'll all experience cancer in some way, one way or another, making sure that the point isn't lost, I think is super important. And I think reminding people of that every day is not too much to ask. I think a lot of times we get stuck in the weeds of how to write a certain line of code or how to design a certain layout. But I think we all are at least aware that that's not the point.
Thanks, Jackie. Winnie.
Well, that's a hard one to follow, Jackie. I think the inspiration that I have to make sure that it's anchored in a way that is customer centric is that we're here to, with our different backgrounds, we're here to move this forward, right? So part of the acceleration of what we're trying to do, because we're building a platform, we're building a technology, like at the end of the day, this is about like, who are we building this for? It's for, people that we serve. So being able to meet these people and to, be understanding of, all the pieces that we have to piece together, because there's a design component, there's a technology component, there's an experience component of whoever the end user is. Like it gets pretty complicated, because then you start layering like all these different things together. And where we come out with, what that truth is ultimately what we materialize. And that's kind of what we're after.
Thanks, Winnie. Avi.
I think it's a combination of what Winnie and Jackie said. They've covered it all. But I think what's important is, number one, of course, the personal experiences, right? When you know people who are going through them, it's very important to understand what they're going through and what they're dealing with, and what are their pain points in their cancer care, because that helps you understand the gap. So it's very important to talk to people who are dealing with such a situation, because that inspires you to find a solution for them. And then again, the second thing would be just working at MSK, talking to like all our panelists here. These are just amazing people who are dealing with different type of problems we're trying to solve every day. Just talking to each other, hearing what they are trying to solve for, versus also the kind of patient journeys they've seen in their life and what ideas they have, also inspire me personally to think outside what I'm focusing on that day, right? To capture everybody's gaps and building on something and developing something that will be very impactful for the patient, for the institute, and for the greater good.
Thanks, Avi. Christina.
So for me, I have a very unique story to tell, but it's not unique in terms of everybody else's. I lost both of my parents to cancer. And I went through a phase at MSK where I was a professional here. I was a caregiver with a patient here, or patients here, and really internalizing the compassionate care that our clinicians provide for our patients here, and the way that they interact with us, the caregivers, in that space. And really thinking to myself, what can I do to make this process easier and better for everyone that's going through it? And I think that that's the little bit of legacy that I want to leave behind. I want to sprinkle a little like pixie dust across the world, that, we all go through challenges and we go through losses, but in it, we can find what makes it better. And for me, technology and advancing technology makes it better.
Thanks, Christina. Louis.
Sure. This is, I feel bad that people keep on going. It gets harder and harder to answer because so many people are so correct. I guess the two ways for me personally that I think about it is, one, people who are going through cancer, it's a very difficult time in their life, not only for them and the patient, but also for the caregiver, right? And so I think it's easy to forget the gravity of all of these different interactions that they have with their providers and with the MSK more broadly. So I think you need to think of technology less as its own thing and more as a kind of facilitator of humanity, and getting other things like paperwork out of the way so that the doctor can spend more time with you, right? And then I think the second way is, it's easy to see cancer as this kind of huge thing that, while unfortunately many people have experienced part of it, I mean, we all are health consumers, right? And so while you may not have experienced cancer firsthand, you probably have experienced something like a broken leg or a broken ankle. What were the frustrations that you had? And think about it from that point of view as well.
Thank you. That's excellent. Dom.
I think I echo a lot of the caregivers among us. With my personality and experience, I've been involved with quite a few rounds of my friends and families, not just cancer, but like cancer, heart disease, and other journeys. And I think, it it just gives you a lot of a different understanding of the domain. Um, Usually during the time that users are using our products or the health consumer products, they are under great stress. Their ears are ringing, they can hardly think, or they might be sick from treatment. They just, they're just scared, they're fed up. The cognitive load is just not what they used to be. So, or normally is. So, you might look at a screen and say, oh, so you have a list of documents, what's the big deal? But, if you kind of think about it through that lens, they can barely comprehend what's happening to them. And now they have to look at screen full of foreign information that they cannot even understand. So it gives you a lot of insights to, truly, like, you just gotta look through what you're doing, through that lens. But on the flip side, everyone I've met who have gone through cancers are amazing fighters. Like there's this like fighting mentality that, like, I honestly don't know if I have in me, and I have hereditary risk. So, but that there's such a desire to fight, so it's not a pity party. You really want to help them understand what it is they're looking at, help them comprehend this moment of amazing, fogginess. At the same time, you just want to ease the weight so they can keep fighting the battle that they're determined to fight. It is a very unique mindset. This is a very unique mental model to look through all our design work. And that's really what kind of the insight and what drive us to, design things better and differently.
Thanks, Dom. Really great points. John.
So yeah, I mean, for me, the thinking about the experience and how we design, it really comes from a couple of different angles. A lot of it is, of course, just when I used to be on main campus, just walking through the campus and seeing the patients and seeing the small interactions of family members with each other, and just realizing at that point on just a simple walk to the cafeteria that like there are real lives at stake here, but and anything you do can help. And then personally, my wife was diagnosed with cancer 2 years ago. She's doing well now. And when we were going through that journey at Sloan, actually, it was funny because one of the tools that we had to take in terms of family history questionnaire was actually developed by one of my colleagues, not on this call, but her predecessor. And we went through the whole process. And at that time, I was seeing the tool in action, and I was able to bring back notes to the manager saying, look, this is the good parts and this is bad parts. And I actually, like, at the end of that clinical visit, pulled out my ID, like, oh, so I also work here and happen to have helped you help build that thing. Can I ask your question? And we were actually able to do a little download there on the experience. So yeah, so I think it resonates on multiple different levels, but having gone through that journey from the patient perspective on a more intimate level, I would say it definitely drove home what I, more on a casual basis had, taken seriously, but still hadn't really, internalized.
Thanks, John. Lernik?
I'm here. That's good. Yeah, I was thinking actually through the answers, and they're all very, very, of course, true to what also I was going to say, but I'm going to put it in a different way from a little bit my perspective, that I think your personal life experiences makes you a user. And basically that's how you bring that experience into life. We all have experienced different friends, family member, colleague, neighbors, I'm getting calls all the time in terms of they're confused about their health plan, they're confused to where to go. That makes me a user when I'm working on a product to bring that frustration, their voice into life in terms of the way that I implement, the way that I think of a concept, the way that I implement a product to play a user role from bringing their voice into a product.
Thank you, Lernik. Everett?
So, of course, agree with all the sentiments that have been shared. I'm going to try to answer this a little differently. I think it's about family. And as a clinician, this is about my colleagues and my peers and how they use technology to help in the care and the diagnosis of all of their patients. And, medicine is very challenging. It's very complex. And the tools that we are giving our clinicians to use to interface with their patients needs to be extraordinarily seamless, and it has to execute with the precision that I think one of our panelists described earlier. There is no room for error. And so the ability to help, my peers, my colleagues, in being able to treat and be there for all of the patients that they care for is so motivating and so important. And it drives everything, that I do, because I know that in helping them, I am also helping all of the patients that they interact with on a daily basis.
Thank you. Fernanda?
Yeah, so it's hard to follow after everybody, but the way I think about it on a day-to-day basis is I have the clinical lens. I cared for patients. I know what it looks like when we're in the clinic and how challenging it can be for us to have a holistic view of that patient and that patient's care. I too have been a caregiver and affected by cancer in my family, and I have been a patient as well. So I have seen 3 parts of this story. And so every time we go through and trying to solve specific problems with using digital technology, I'm always wearing these different hats and saying, okay, what do I remember from that experience and this experience? Of course, my opinion will never be the only piece that will guide how we're going to implement a certain product, but it helps us think through what are the main questions that we need from our users? How will we engage? We work very closely together, everyone here. So we all have different experiences. We talk through it, and we really try to get to our users and meet the user needs with the digital products that we're developing. So I think that bringing that to your day-to-day and knowing that ultimately that will have an impact on our patients, on our care team, our administrative staff, is really what drives us. And it's just really exciting to be working in such a diverse group and having all these experiences in addition to engaging directly with our users.
Thank you, Fernanda. And last but certainly not least, Liz.
Thank you. So to round things out, I started my teenager years thinking I was going to be a journalist, and this led until I went to college. And having written for a number of newspapers, local newspapers, granted, in Pennsylvania growing up, I had very much a journalistic mindset from a very young age. And I bring this inquisitive mind to the work I do today still, and it really does impact my design work as far as knowing to ask the right questions and really uncovering the who, what, when, where, and why, of course, and then getting into the how. So what is the data that we need? What is the technology stack that we need to build whatever we might be imagining? So I think asking the right questions is fundamentally important, while at the same time putting aside any assumptions or biases along the way that might, potentially derail us or lead us down an unproductive path. So I think that's something from very early in my life that still carries through to the work that I do today.
Thank you, Liz. Well, I appreciate everyone joining in and spending time with us on this Wednesday evening. Thank you to all the panelists for giving your wonderful insight and your true raw answers. Thank you to everyone that tuned in, and we look forward to seeing you next time. Feel free to look at our, like I said earlier, the career site if you need instructions on where you can find it. We'll post it in the LinkedIn page. Feel free to add all of us on LinkedIn, and we look forward to hopefully meeting you in the future. Have a wonderful night, everyone.
Thank you.
Thank you.
Thank you so much.